Down Syndrome Awareness Month, and the theme for 2023 is focusing on creating awareness, creating love for the children that are living with Down syndrome, and how best we can help them to improve the quality of their livelihood. Welcome to the Pediatric Voice. I'm your host, Dr. Helen Namsoke, and today I'm hosting Dr. Joyce Naroga, and we are going to discuss Down syndrome in depth and how best we can improve the livelihood of our children that are living with Down syndrome. But before we dive into the discussion, first, let's have the guest profile.
Joyce Naroga, a pediatrician at Bethany Women and Family Hospital and TMR Hospital, Nalia. Bachelor of Medicine and Bachelor of Surgery, Mbarara University of Science and Technology. Masters in Pediatrics and Child Health, Uganda Matters University, Nkozi. Passion, Pediatric Health, especially Pediatric Neurology.
Welcome to the Pediatric Voice, Dr. Joyce. Thank you for accepting our invites. Our guests out there, our viewers out there would want to hear from you.
Thank you, Dr. Helen. I am happy to be here today. How are you, our viewers? My name is Joyce, and I hope that we learned something today about Down syndrome.
Thank you. So, Dr. Joyce, before we delve deep into the discussion about Down syndrome, let's first have a documentary on Down syndrome. Yes, Dr. Joyce, you've heard that documentary. What is your comment about it?
Yes, indeed. As the documentary has told us, Down syndrome, and Dr. Helen as well talked about this, Down syndrome is one of the leading, actually the leading genetic cause of what we call intellectual disability in children. And we'll be talking more about it because it's a constellation of so many things put together. And it will affect so many parts of a body of a child that has it. And as we go deeper and deeper into the discussion, we'll be able to talk more about all of this.
Thank you very much. Now, maybe our viewers out there would want to understand what is Down syndrome, what really causes it?
All right. So Down syndrome, in simple terms, is a group of symptoms. It's one of the syndromes that we have. Maybe I'll first define a syndrome. A syndrome is a group of symptoms or abnormal presentations that occur together, and according to our research, you'll pick a few that usually present together.
So there are different conditions that present together. And when you put them together, they point to something.
They point to a syndrome. Sometimes the conditions may all be there, other times just a few of them, but you're able to cluster them in one basket and say, this could be the syndrome.
So usually these things are related, kind of?
They are usually related, yes.
Okay.
Yes. So now when we go deeper to talk about Down syndrome, after the little breakdown, Down syndrome will as well present with so many things. But what causes it, or what exactly it is? We have an abnormality in what we call chromosomes. A chromosome is a thread-like structure that has your DNA and your genetic material.
It is the one that forms
yes.
It is the one that has our DNA.
Yes.
Okay.
So it forms your DNA, and we all have chromosomes.
It's like the interpret. Let me say, in terms of we are building, we have the blueprint, and
it's your genetic information.
It's like your blueprint.
Your blueprint.
Okay.
That strand that defines who you are. Helen, this is Helen's genetic information. It is held on your chromosome, that single thread. So all of us are supposed to have 23 pairs of chromosomes, which gives us a total of 46 pairs.
46 chromosomes in total.
23 pairs, 46 chromosomes in total. Now, for the children that get Down syndrome, they usually have an extra pair. We actually have 3 forms that we'll talk about maybe at this point in time. So the majority of them, about 95%, they get an extra copy on chromosome 21. Remember we said we have 23 chromosomes, 1, 2, 3, up to
23
23
pairs, that is 46 chromosomes.
Yes, sorry, I hope I'm not confusing the viewers. So we have 23 pairs.
So
46.
maybe before we go into the Down syndrome,
yes,
you said you have 23 pairs.
Yes.
Where do they come from?
All right. So the 23 pairs, you get a pair from mother.
A copy from the mother?
Yes, a copy from mommy, a copy from daddy to make a pair.
So in other words, at chromosome number 1, I get one portion from my mom,
one portion from
and one
mother,
portion from my dad, and they combine and they make...
That is one pair.
Okay.
So you have 23 pairs. Each of them, you're getting a copy from the parent. And that's when we get a total of 46.
So each parent presents 23 chromosomes.
Yes.
Good, thank you.
All right. So in Down syndrome, we will have an individual, 95% of them are going to have an extra copy at the chromosome 21. So instead of having one from mommy and one from daddy to give you 21, the chromosome 21, which is a pair, you get an extra.
Where does it come from?
So majority, this extra can come from either both mommy or daddy, but the majority come from mummies.
Okay, thank you.
Yes, the majority come from mummies. And we shall see what this interprets into as we go ahead. So,
thank you very, very much, Dr. Joyce. Dear viewers, you've heard it from the expert. Down syndrome is an abnormality of simply your blueprint or your genetic makeup, and that is from the chromosomal level. In simple language, I would term it an abnormality in the blueprint. For those of you who do construction works, you know the blueprint is what you follow as you're constructing. So as your body is being made, the blueprint of your body, if there is an abnormality, and she is clearly telling us it is at chromosome 21, at position 21 of your blueprint, and she's saying you have an extra genetic makeup at that position. You are watching the Pediatric Voice and on Bethany TV for Health. Feel free to tune in on GoTV channel 841 and 170 on free to air. You can also watch us live on Bethany TV Uganda, that is on Facebook and YouTube, as well as watch us on www.bethanytv.org on X. Yes, Dr. Joyce, what causes this thing called Down syndrome?
Okay. So the causes of Down syndrome are not so well understood. So as I answer that, I will talk about the risk and the causes, because they work hand in hand. So for the causes, it's as I'd said in the previous section, it comes about with improper division of this blueprint that Dr. Helen is talking about. Remember, we said mommy gives one and daddy gives one to make a pair. There are circumstances where now mom also has her own pairs. Yes, remember every individual
the mom has
23 pairs.
Even daddy has
his 23 pairs. Now I need to get my 23 pairs from them, one from each. Yes, to make a chromosome. Now there are and for that to happen, mom's is supposed, let's say mom's one pair is supposed to divide. The cell is supposed to, and I get a copy.
Pair, maybe they are attached together, right?
Yes.
So for mom to give me one, half of her blueprint, there must be a division somewhere.
There must be a division somewhere.
And the same to daddy.
Same to daddy.
Okay.
Now there are instances where that division will not happen. And then mom gives me two.
So she gives you a full pair?
A full one.
Okay.
Or dad. And that is 21 chromosome. Remember, we're talking about 21 in particular, because there are other abnormalities that involve other chromosomes. So I find myself now with 3 copies. So instead of 2.
Wait a minute. So when mommy brings a full pair without dividing,
yes,
and then daddy
also brings
it's a must.
copy.
Daddy must bring.
Yes.
So in other words, instead of having 2
yes.
at that point, I have 3. So instead of having 46, I get
47.
Good, thank you.
Yes. And the body is a special thing. God made it so special. When it comes to DNA and the blueprint, it should be expressed just the way it should. Any addition or any subtraction changes the dynamics of how the body performs. Okay.
I think builders copied God when they were coming up, because when they're doing their architectural work,
that's true.
When they have a blueprint, a pre-planned work.
Yes.
And in case they do diversions from the pre-planned, actually the houses don't come out.
Things go wrong. If someone puts something where it should not be, something goes wrong. You put away something which should be there, something goes wrong. That is the body. So that is one of the ways that Down syndrome occurs in about 95% of the patients. Then we have another 4% where they are getting their 46.
Okay.
But on top of that 46, they are getting a part, this time not a full copy, but a partial copy, maybe from mommy or daddy, just a partial copy that comes and joins one of theirs. So for them, they will not get a full copy. But even that partial copy, like we've said, any little addition will change things. That is what we call translocation. You're giving something that you should not.
So they've given you a small portion of extra chromosome in your blueprint.
In your blueprint.
Okay.
But you don't need it. It's not supposed to be there. So it also causes you trouble.
It's like adding a little cement in the concrete while you're constructing.
Yes.
Good, thank you.
Or for us women who boil milk, getting a little salt. It does not have to be a lot. Just a pinch, you put it, you add it to your milk.
Boiling.
It will go bad.
Okay.
Yes.
Thank you.
So something like that. And then the last group, about 1%. For them, most of their cells will be, let's say there's a division. Some cells are okay. Then other cells, for whatever reason, have the 3 copies, like group number 1. What we call mosaicism. And the reason for explaining this, it will also help us understand why these children present differently. Why some seem to have, features that are standing out and screaming. And then while others will come and sometimes even as the doctors will say, it looks like, but let's watch.
Not sure. Let's
we are not so sure because the features are so subtle. And those ones will usually find them in that 3rd group. Because some cells are good, but other cells have the extra.
Wait a minute, Dr. Joyce. You mean this blueprint, this abnormality is happening in almost all the body cells?
So in the 1st group, in all the body cells, the 1st group, the 95% we talked about. In the last group, some cells are okay. Some cells, we have an added blueprint, an addition that should not be there.
Okay, thank you very, very much, Dr. Joyce. So our viewers out there, parents out there, are interested in a conversation and want to know what makes one baby. We've seen about 1 in 700 live births. That means it is so frequent. I've actually seen the statistics saying there are about 3,000 to 5,000 babies in the US that get diagnosed of Down syndrome annually. And I felt like that number is quite huge. Yeah. But first, what makes one baby get Down syndrome and the other not?
Okay. So that would be like, what would be the risk of one baby getting it and the other not? So in literature so far, because in medicine we depend on research, so far we have one very clear risk factor that we can point to. There may be others that I'll talk about, but the biggest is mommy and maternal age. What we call maternal age of conception. At what age does mommy get pregnant? That is the biggest risk factor for Down syndrome. Literature tells us once mommy is above 35 years, let's say, the chances of having a child with Down syndrome increase. At 35 years, if we get a group of about 350 women who are 35, one in the 350 may have a child with Down syndrome. If we get a group of 100 women who are 40 years, 1 out of 100 will have a child with Down syndrome. As age advances, at 45, the more chances. At 45, they tell us the chance of having a child with Down syndrome may be 1 in every 40 women.
That is so frequent.
That is so frequent. And if you go further, the older the mother gets, the higher the chances. So that is the most definite risk factor that we know. But in other environments,
so that means as a woman ages, their genetic makeup gets a bit messed up.
It gets, the way our cells divide, they may not divide as well as, you know, when you're younger. Those are some of the speculations as to the cause of the increase in Down syndrome as a mother gets big. Big in age, not in size.
Okay.
Yes.
Yes. Any other risk factors?
So the other risk factor, and this one I want to be very careful about, there's a little genetic component, especially in the second group that we talked about, where someone gets a part of chromosome 21, the translocation, being added to their DNA. Some of those it's genetics. There's a lot in genetics. But some of those just happen.
In other words, it runs in
nowhere.
family. Is that what you want to mean?
So there are changes, yes, that can run in family. So with the translocation, some can just happen without it necessarily running in the family. But 25%, they tell us 25% of those, of the 4% that have that translocation.
In other words, 1%.
Yes, 1%. It can be from a parent that actually has Down's syndrome.
Okay.
Yes. Actually, the literature says about 50% of women with Down syndrome who manage to get pregnant have a 50% chance of also giving us a child with Down syndrome.
Thank you very, very much, Dr. Joyce. Our dear viewers, you've heard it from the expert that one of the commonest risk factors for Down syndrome is advanced age for the mother. In other words, you know, these days we are so eager on chasing the boardroom, on chasing our academic careers. So as we are chasing the career, as we are chasing, we should also look at the genetic clock if we wish to have children. The earlier we have our children, the better. Dr. Joyce, how would I tell that possibly my child could have Down syndrome? By just looking at them.
Okay. Now that's a loaded question. Because like we said, especially in the first group, which is the biggest, all the cells have an extra blueprint, which should not be there. Something has been inserted. Now this entire body is made up of cells, from your brain to your toe.
From the tallest hair.
From the, I tell you, you know. So that is where the challenges now come from. Because all cells are implicated. These children are going to have troubles from head to toe.
Okay.
And now, in simple terms, we'll talk about the things that we can see with our own eyes. And then later, as we go on, maybe we'll talk about the things that we cannot see. Now, things that a mother out there, a father, a guardian can look at and suspect Down syndrome, starting from the head. There are many. This list is not exclusive. Some of them will come with heads that are flat, head to toe, flat. At the back, abnormally flat.
Talina ankona.
Talina ankona.
Okay.
Then when we go to the face, we have eyes that are slanting. I wish we had a picture. A picture to show, but they are slanting, not our usual curve. And then some of these ones what we call the folds. Here. Yes, there should be a curve, but some of them, this is flat.
The nasal bridge.
The nasal bridge is flat. And then some even they are folds, what we call epicanthal folds. You see abnormal folds around the eye. Then you come to the ears. The ears are abnormally low. Usually they should be
at the level of the eye.
About, yes, the level of the eye, or even a little above. These little ones, a little above. But you'll find they are low, abnormally low. Then we come to the mouth. For some of them, especially as they grow bigger, you'll see they have a protruding tongue. And most of them usually, they move doing that. Then some have a short neck. The head is almost sitting
on the chest.
On the chest. Those are very easy things to see. Actually, people usually tell you there is a typical look that is on the face.
Kind of, they look like their siblings. Like they resemble each other.
Yes. And then as you go down, the other things that a parent may be able to pick up, when you look at their palms, some of them will have, we have these things that people like reading, fortune tellers, and people would say, I have M for money.
Oh, even they have M.
You have M?
Yes.
Okay. So for them, there's a tendency to just have one transverse one running across. Running across, and it's very prominent. And for some of them, these fingers and hands, they are also short and wide. Just abnormally short and wide. Then as you go on, you may even find they have extra flexible joints. Like, this is maybe so.
In other words, the joints are soft.
So soft. Here is soft here. You know, the joints
they can't control their neck very well.
They can't control. And actually, that could be an effect of hyperflexible joints, but usually also the body doesn't have, we call it tone. The body doesn't have, and it pours in simple, like a rag doll. Or like a newborn, you know, when you've just a newborn, their tone is not as bad, but these ones, you know, they pour. They can't like hold their body and their positions firmly. We call that hypotonia. I hope I have explained it well. Now, as we also go down, maybe at the feet, the other thing that they may be able to see with the eyes, they usually have abnormally big space between the big toe and its neighbor, the next small toe. You know, yes, you just see a big space and you're like, oh. So those are some of the features that you'll be able to see with your eye, and that will make you suspect that this child may have Down syndrome. Now there is more.
Okay, thank you very much, Dr. Joyce, for that wonderful description about the signs and symptoms of Down syndrome. Hope our viewers are getting them very clearly. And today we are discussing Down syndrome, but the main focus will be how best we can improve the livelihood of these children that are living with Down syndrome. But first, let's have the break.
Bethany TV for health.
What if every meal you enjoyed could be a source of not just delicious flavors, but also essential nutrients? Introducing Food Fortification, a powerful solution to address nutritional deficiencies and enhance the health of communities around the world. Catch the Nutrition Spot this Thursday, 8 p.m. live on Bethany TV to further explore the concepts. With our guest nutritionists, Juliet Tumwebaze and Akankwasa Wilson, hosted by Gif Nakainga.
Health Minutes on Bethany TV.
Mumps is a contagious viral disease, and it mostly affects the salivary glands, which we call the parotid glands. The parotid glands are found between the jaw and the ear. That's why you see that there is swelling that occurs between these areas.
It is transmitted via airborne droplets and primarily affects children. Treatment is supportive.
Supportive meaning you manage the symptom. They will have to first pause on going to school. You have to give plenty of fluids. Signs and symptoms vary. For example, it can be a mild disease, it can be a severe disease. For mild disease, the child might have some fever, they might have pain in the jaw area.
Other symptoms include malaise and swelling of other salivary glands. Complications include otitis, hearing loss, pancreatitis, and a septic meningitis.
So what you can do as a parent at home is first and foremost take your child to the hospital. When they examine the child and test them and see that there are no complications, the child can actually go home.
Better healthcare for a better tomorrow. That was the Health Minute.
Introducing Medical Minds with Dr. Andabati.
And these tubes can be so delicate that sometimes they get damaged. Some people have gotten the damage because they have undergone some operations. So damage to the tube system is one of the big problems we also do see.
The groundbreaking show that takes you behind the scenes of the medical minds.
You will explore cutting-edge treatment and technologies revolutionizing reproduction health.
Now, in retrograde ejaculation, we get damage to the junctional valves, which I could say.
Learn about the science behind fertility, contraception, and emotional journeys that several women trek.
Every Sunday, 8 p.m, live on Bethany TV. Bethany TV for health.
Welcome back from the break, dear viewers, and thank you for watching Bethany TV for Health. You can watch us live on Bethany TV Uganda, that is on Facebook and YouTube, and www.bethanytv.org, and as well as Bethany TV Uganda on X Spaces. And you are watching the Paediatric Voice, your usual Wednesday evening plot, where we discuss the different childhood conditions and how best we can improve the conditions of our children to make sure that they grow to their full potential to be productive adults. Remember, a healthy child eventually amounts to a healthy adult and a productive nation. And you're very well aware that the biggest chunk of Ugandan population are actually people living under their age of 30 years. That is, most of our population are youth. In others, if we take care of this generation that is young, we are likely to get a better adulthood and population, as well as a better Uganda. Remember, our focus is to work towards a middle income status for our nation. And this Wednesday we are discussing Down syndrome. As you're very aware, we earlier told you that this month of October is the World Down Syndrome Awareness Month, and the focus for 2023 is to emphasizing showing them love and how best we can care for them to improve the quality of their livelihoods, that is to improve their intellectual ability and get the best out of them. And this week we are hosting Dr. Joyce Naroga, who has given us the clear definition of Down syndrome and risk factors, as well as the signs and symptoms of Down syndrome. I'm your host, Dr. Helen Namsoke. Now, Dr. Joyce, you clearly, before we broke off, discussed the physical things one would use to tell that a child has Down syndrome. Are there conditions or elements that are associated with Down syndrome that one would be worried about in case they have a child with the signs and symptoms you've discussed before?
Yes, definitely. And even for those conditions, we approach them from head to toe. As we said, all the cells of the body are involved. So from head, some of the things that we should be concerned about is our level of understanding, what we call intellectual
ability.
Yes, ability. The way, you know, they understand, get information, process it, and represent it. And that, of course, will affect their schooling and career life, and even the way that they interact in society. Then the other things mentally.
I had a child, one of my patients, actually she complained, and she came disappointed, and she said the teacher said she does not understand. And when I looked at her, she had some of the signs and symptoms you described earlier. And I was actually very hurt about such a comment from a teacher. So maybe people can have a better way of, you know,
of communicating. We want to keep away from statements like you don't understand, mental retardation. That's why we got rid of those. We call it intellectual disability. And that also comes at different levels. Yes, because no one is really at 0%. Now, when we use stigmatizing language, it affects the way we are going to harness our percentage. Because for most of them, they'll say, you know, their intellectual, their IQs, what we call IQs, they're between 30 to 70. You can do something very big with that. So you don't want to say they do not understand. So they understand.
In others, they are just slow at learning. So you need to just give them a little more time as you're teaching them
as we are teaching. And I think those are aspects we'll talk about as we talk about how to manage and support them. Just give them time. Just identify what they are good at, how they learn, and harness that.
Okay.
Yes. And then what we call behavioral disorders. I know a number of people in the population have heard about ADHD. It's becoming a bit common. A very hyperactive child that
does not
hardly pays attention.
They are always doing something.
Yes. And you can't just grasp their attention. We are having what we call autism or autistic spectrum disorder. They are also a bit destructive, prefer to do things their own way, in a certain way. They do not really focus a lot.
They don't like to interact so much.
They don't want to interact. They prefer their routines. You know, some may have depression as they grow and they realize I'm a bit different
from the rest.
Yes, some conduct issues. You say a child who's a bit aggressive, and it's not that they're just bad-mannered. There's this thing in the background, so we need to understand them. So mentally, that is one of the things to look out for. Then as we go down, maybe also mentally sleep. Some of them have challenges with sleeping. In the night, they snore and fight for air, what we call obstructive sleep apnea. And this has to do with, like we said, the low tone. Their muscles. I think
even their short neck.
Yes, the short neck, the low tone, so it closes off the airway. And those are some of the things you need to address, because you may take it as a simple thing, but if it's long going, it affects the oxygenation of other organs of the body, and that can cause long-term issues. All right? For some where issues are really severe, the tone and coordination, even feeding, can become a problem, and then we're having a child who's not gaining weight, and the issue is they cannot really feed well and take in.
Okay.
We come down to the chest. They are very prone to getting lung infections in general, because their immunity is also low. Yes, so these are children, we know they are having a high temperature. They're not acting the usual. We run to hospital, don't sit, let them check them out. They have other actual abnormalities in the lung, in the heart as well, what commonly we call holes in the heart in the community. You know, between some chambers of the heart, left and right, will communicate, yet they are not supposed to communicate.
Let's take it simple, holes in the heart.
Holes in the heart.
Okay.
Okay. Then as we go to the digestive system, some can be born when some places are narrow in the digestive system, in the intestines. And you know, a child eats, but they're not passing stool. You know, they are vomiting, the stomach is swelling. Or some have a big, what should we call it, large intestine that holds poo-poo for long, and they may take ages without poo-pooing, and it even becomes bigger. You know, what we call Hirschsprung's disease in medical terms. And all these things need to be addressed.
And Dr. Joyce, all these things, are they acquired or they are born with?
They are born with them.
Okay.
They are born with them. Some even the anus is closed off. So these are babies that need a good assessment at birth to try and pick out whatever we can. Then there are things that also affect the blood system. They are prone to getting some types of cancers. It's a blood cancer, leukemia, one type, you know, and hormones. Also things to do with hormones and the glands.
You talked about delivering.
Yes.
If they manage to deliver, what are the chances that if my child is born with that syndrome, are they likely to have, to give me grandchildren, to have children of their own?
Okay.
Later.
Okay. So the literature we have so far tells us if it is a woman, the chances that they will be fertile are higher than if it is a man. Some people put it at 50% of women to 70% of women with Down syndrome will conceive, are fertile.
Yes, okay.
However, for the men, most are infertile. Very few manage to give birth.
Okay.
Yes, most are infertile.
You are watching Bethany TV and we are discussing Down syndrome. It is the World Down Syndrome Awareness Month, and this is October. That was started way back in 1980 by the International Organization of Down Syndrome that helps them, give them hope, give them love. And this year's focus is to show them love and harness care to make sure that we improve their quality of life. Now, Dr. Joyce, it appears like caring for these children that are living with Down syndrome is a hard work because as I can see, there are so many abnormalities that are associated with it, like the sleep issues. You know, I'm very sure parents are now thinking about it. Is my child breathing in the night? The heart issues and so many, the intellectual issues. Looks like it is hard work taking care of these children. As a parent out there, how best can I show love and improve the quality of life and get the best out of my child despite the challenges they're born with?
Okay. So as a parent out there, you've given birth to your child, you notice they have these features that you do not.
Either as a parent I've noticed or I've been told by the health worker. Been
told by a health worker. So yes, the first thing, and you've mentioned it, is get in contact with the health worker, because we need someone that is going to assess this child. Like we said, they have different levels of presentation. There are things that can be picked right there at birth. There are things that will not be picked but may start showing up later. So the first thing I would say is keep in touch with your primary health care provider, with your doctor. You know, when they tell you come for assessments, go for those assessments, because the care is lifelong and they are not done in one go. So many things need to be done as the child grows. Okay? And even to give them our best, it will depend on their age. Like we said, head to toe. We start with assessing, are they developing well? Once we catch the child, you know, that is lagging behind, we'll tell you bring in someone to help, physiotherapist, occupational therapist, to help them learn to do things. Care for Down syndrome child is multi-sectorial. Big members of the medical team, the community, the family, the schools, if we are going to get the best out of these children. So some of the things I mentioned, there are so many, and in the interest of time, we can't talk about them all. But the mental things, these children can be helped. The physiotherapist can help them be able to do things. Push, speech therapy, push. We have our psychiatrists, psychologists, the behavior things we talked about.
Like the hyperactivity, them not settling.
Yes. This child doesn't have to become the bad, aggressive child beating everyone in the village. Those things can be managed. The obstructive sleep apnea, they can be checked and actually given help. The chronic lung infections, If we catch it early, because these are the things that cause them to actually die earlier. Heart and lung infections, one of the commonest ones. So if we find a child that has those, then we attach you to care. You know, your heart doctors know what exactly is happening with the heart. When do we have to come in? When don't we have to come in? Okay? Generally, every body system has someone to take care of it. Vision, we had forgotten to talk about vision. Some of them have vision issues, long-sighted, short-sighted, abnormal movements.
Others, they don't see very well.
They don't see well. Some have funny movements of the eyes, some even hearing. And you know their brain capacity is good. You think, oh, they're not understanding, yet the child is not hearing. They're in class, but they're not getting information. And you think, as we said, they're not understanding. So all these assessments, we do them at different points in time.
So what I'm getting from your discussion, we should not generalize these children that are living with Down syndrome.
Do not generalize.
So in other words, we should have a one-on-one assessment of every child that we suspect to have Down syndrome and do the appropriate care as the events evolve.
Yes.
In a particular child.
We should avoid, oh, my child has it, this is what they did. It helped, just do that, you don't have to go to hospital. No. The way they present is different. The level of support they're going to need is different. Not everyone is going to present with all these things, because now we may be shaking and trembling.
This care you're talking about looks like it's expensive. If I have to bring in several health workers and specialists to do for me whatever they are supposed to do, in our African society, it may be quite unmanageable. So what can a parent in their own means do for their child to improve their quality of life?
One, love your child. Issues, especially with development, also have a lot with the way we interact with these children. If you're going to lock them up as the abnormal child that you don't want people to see, that's going to affect them.
So you're going to depress them?
You're going to depress. Let them be part of the environment. If they have siblings, let them interact. Depending on what the doctors have told you, the level of injury, they have to go to school as well. Those are simple things that every parent does.
Talking about school, do they attend a usual school? You know, our curriculum is so aggressive.
Yes. Now, this is when we come case by case. There are those, the group 3 which I told you, where some cells are okay, some are not. Some of them are almost like everyone else, and they can do in normal school. But those that are highly affected, you don't want to put them there. You want to put them in a special school where they will give them time, where people understand that they are special in their own way, where a teacher is not going to expect them to get at the same level as others. But what is important is they can do school, they can do vocational activities. They're actually good at these things. Music, you know, games, sports, don't restrain them. If carpentry, even formal education, case by case, let the child be assessed, be advised on which route you can go. Yes, and then the other things that you can do as parents is, apart from interacting, engaging them, making sure that they are going to school, being observant about anything that's abnormal coming in and running to hospital, is also protect them, because these are children that are prone to abuse.
Oh.
Yes, they are very prone to abuse. Back then we were worried about the girl child, but the world has changed.
Even the boys
Even
can be
the
abused.
boys, yes.
Dr. Joyce, do these children grow? I have a friend who has one of them.
Yes.
And as a family, they are worried. They are trying their level best to improve the quality of life for this child. But of course, as you've seen, it involves a lot of finances. So it is draining actually the family account seriously. But their question is usually, as we're injecting in this so much money initially, because they had to go for heart surgery and so many others, the question they have at hand is, but will this child grow, or we are wasting family resources for nothing? Do they grow?
These children actually grow, especially with all the new interventions and the multi-team dimensions and help that we've mentioned with. Back then, in the 80s, 70s, they would give them about a limit of about 20 years. But if we follow all these things that we've been talking about, they are growing even beyond that age. So yes, they do grow. What will kill them most, like we said, are these complications that come with the condition, and if we don't manage them. But if they are managed, they do grow.
Can they be as productive as a normal child later on in the future?
Yes. So also productivity is an interesting thing depending on how we measure it. But yes, like we said, there are things that they are good at.
Okay.
We don't look at productivity just as, you know, academic, I've got A, 4 in 4, 8 in 8. What are you contributing to yourself, to sustain your family, the community, and the economy of the nation? That's what we are talking about. And if you've equipped them with enough knowledge, class knowledge, and then with enough skill, they are productive.
I saw with the World Down Syndrome organization, actually this month they are focusing on improving their sports area. They are teaching them volleyball, they are talking about basketball and athletics. And I thought with their lot on, they would not manage actually to engage so well in sports, and looks like they are prospering so well in the world of sports. And dear viewers, there are sportsmen out there, as you can see, some of these support different teams, Man U, Arsenal, and so many, actually taking home a big chunk of money as compared to the rest of us who do the white collar jobs. In other words, if your child has a disability in one area of life, please look at them and see what best can they do with their life. They usually, God is so faithful. Yeah. There is usually that aspect of life that they are so good at. Maybe they are so good at crafts, or they are good at their careers, singing, acting, and so many others. Woodwork. So try as much as possible to develop that area or that aspect of their life that they are brilliant about, so that you can get the best out of them and they are productive to you, to themselves, to the family, and the rest of the nation. Now, Dr. Joyce, in a minute, what's your take-home message?
We have a slogan that says, disability is not inability. If every parent, everyone in the society can think about that and actually believe in it, our nation will go far. People that are disabled are not people that are unable. So I just want to implore the community out there, the parents, all of us, once, not just Down syndrome, but all forms of disability, get these people, see what they are good at, because like Dr. Helen has rightfully said, they're always good at something. Harness that potential. Give him their best, give her her best, give him his best, and then you'll see something come out of that individual.
Okay, thank you very, very much, Dr. Joyce Naroga, for coming into the Paediatric Voice and for that wonderful discussion about Down's syndrome. Dear viewers, thank you for watching the Paediatric Voice and Bethany TV for Health. And today we have had a wonderful discussion about Down syndrome, and our theme was how best we can improve the quality of life for these children that are living with Down syndrome, as the theme is for 2023. Remember, October is the World Awareness Month for Down syndrome, and the theme is to show them love and harness care to make sure that we make them as productive as possible. And we have clearly heard it from the expert. It starts from identifying your child. Very many of you, sometimes when we tell you that there is an issue with a child, you are a little bit in denial. Sometimes you're somehow right, but at first you need to think through why my child and why not the other child. It starts with a point of acceptance and then loving yourself. It is not your fault, by the way, that there is an abnormality with your child. So accepting the issue and then falling in love with it, and falling in love with your child with love and continuous stimulation of your child, and being close to your child helps you identify the positive abilities in your child so that you can hope and act on them and harness care for them and stimulate their areas of positivity, and that will make them a more productive child or adult in the future. And remember, not all of us get our levels of success from academia and white collar jobs. As you've heard from the expert, they tend to have some level of intellectual disability. So they may not perform well in the classroom, in the bedroom, but they may be a success in other areas of life. That is it we had this week on the Pediatric Voice, your usual Wednesday plot where we discuss the different childhood care issues and how best we can improve the quality of lives for our children. I've been your host, Dr. Helen Namsoke. Till we meet next time.